Hi, my name is Felicity Morris and I'm a third year PhD student based in CureMed, which is the Cardiff unit for research and evaluation in medical and dental education in the School of Social Sciences, Cardiff University. My study is looking at physician associates in Wales, and this presentation will focus on the experiences and impact of physician associates during the COVID-19 pandemic. The study has been funded by CES2 and I have been working in partnership with Health Education Improvement Wales, otherwise known as HEIW, and Authentic World Limited. Throughout the presentation, I'll refer to physician associates as PAs. So if you're not familiar with PAs are defined as medically trained generalist healthcare professionals who work alongside doctors and provide medical care as an integral part of the multidisciplinary team. PAs are dependent practitioners working with a dedicated medical supervisor but are able to work autonomously with appropriate support. 5 objectives of the study were developed from exploring the existing literature and working with HEIW. So these were to explore the experiences of being a recently qualified PA and the transition from student to qualified PA, the impact of PAs on services, the embedding of PAs in the multidisciplinary team, how patients respond to the role, and if there are any similarities or differences across the primary and secondary care settings. The study was split into 3 parts. At first, case studies were undertaken which involved semi-structured interviews with PAs, clinical colleagues, managers and patients across 4 health boards in Wales. The interviews were done remotely via Teams or telephone. The second part was the All Wales PA questionnaire. All PAs working across the 7 health boards in Wales were invited to complete an online questionnaire. The questionnaire was built in online surveys and then distributed by email. It became apparent that the pandemic was acting as a barrier to recruitment, particularly for patients, so an amendment was made to Part 1. So instead of case studies, participants were invited to take part in one-off interviews. So this was exactly the same participant groups, health boards, and again, interviews were done on Teams or by phone. But this time recruitment was also done through social media and Healthwise Wales. Healthwise Wales facilitates health-based research by providing researchers access to a cohort of participants who have consented to be contacted about upcoming research. So Healthwise Wales send an invite email out to those who have registered and are eligible on my behalf. Across the 3 parts, a total of 82 participants took part in the study. The next slides will share some of the findings related to the COVID-19 pandemic, which have been broken down into 3 areas. The study was developed a few months before the start of the pandemic, and although this created challenges for the study, it's provided a unique opportunity to explore the objectives in the context of the pandemic. The findings shared are from the qualitative data collected across the 3 parts of the study, which have been analysed thematically. So looking at the first finding, the experiences of working as a PA during the pandemic, NHS services and staff faced unprecedented demands across many areas, so unsurprisingly and similarly to other healthcare professionals, PAs across the study reported an increase in stress and anxiety as a result of the pressures and demands attributed to the pandemic. Primary care faced radical adaptations to services, and the primary care PAs discussed the challenges associated with the shift from seeing patients face-to-face to predominantly remote consultations. This reliance on remote consultations created a fear of missing something life-changing, as well as limiting their opportunities to practice clinical skills. Some of the other negative impacts included personal fears of being infected and transmitting COVID, a loss of networking with other PAs, and disruption to role development personally and more widely. But on the other side, examples were also given of development opportunities personally and being able to be involved in service development. The quote on the right-hand side shows an example of this. There were also some PAs who felt that the pandemic had limited or no impact on their work, but this did seem to be setting dependent on their exposure to COVID. Moving on to the second finding, the impact on training and learning. There were 4 key areas that the PAs in the study discussed. PAs, like many other professionals, are expected to maintain an annual CPD portfolio, but with all efforts geared towards responding to the pandemic, organised learning was disrupted. There were reports of training courses being cancelled or rescheduled, and examples were given of not being able to attend clinics to develop specialist skills. PAs also faced losing out on informal learning opportunities, such as doing ward rounds with consultants, which would have usually been a teaching opportunity. But as things became so busy, the time wasn't available for this. So in turn, opportunities for legitimate peripheral participation were affected. The shift to online training was deemed by some as really beneficial for accessibility, though others did find this more difficult to engage with. And this also feeds into the impact on university courses. An example of this is one PA involved in teaching said, "Some things are easier to do online than others. Dermatology is fairly easy, but how do you do cannulation?" As well as this, placements were postponed or cancelled, so some PAs would have missed out on exposure to certain specialties and weren't able to take full advantage of their placements. And finally, the impact of PAs during the pandemic. It was considered that the pandemic had served to highlight the benefits of PAs. The PAs were seen to add to the workforce at a time of increased workloads and staffing shortages. The continuity of the PA role has been highlighted as a significant benefit of the profession, both generally and in the context of the pandemic. But some of the participants also noted how flexible the PAs had been in adapting to the needs of the time. Following on from this, a key question was, has the pandemic changed the way PAs are viewed? Some of the participants felt that because of the changes to working, more staff were exposed to the PA role, and with the pressures of the pandemic, it had highlighted the positive impacts PAs can have. But on the other side of this, some did state that it was too early at the time of their interview to say if the pandemic had changed perceptions, and for some, their perceptions had generally changed over time, and this was unrelated to the pandemic. An interesting point was also raised that the PAs were seen to be getting stuck in just like any other members of the team, so the pandemic may have accelerated their embedding within their teams. Thank you for taking the time to view this presentation, and if you have any questions or comments, please contact me directly by email. Thank you.